Hello. Hi, Cindy. Good morning. Hi, Jean. And Pam, right? Penny. I knew it wasn't Robert. Stevie, good morning. And that's it so far. All right. Well, hello, ladies. Anything in particular today that you'd like to ask or discuss or let me know about? I'd like to know if there's anything in particular. What's my intention for today? I like to have an intention sometimes and sometimes not. But I think today I definitely came here thinking strength, not to scare you off, because it's always whatever you can do or should do. And I was speaking with someone about weight bearing and body weight versus doing weights and how valuable body weight is. And then I was also looking at an article that astronauts lose 1 to 2% of bone density loss in 1 month. So just this complete value of using gravity as our friend. And anyway, all right. So, okay, good. Well, I like to hear that. Because sometimes I say that and I think, oh no, someone's going to be like, what? Strength? I don't want to do strength. Thinking that it's going to be too much. But of course, as always, only what it should be for you is what you should do. Okay, so for today's practice, I want to begin in a posture called supported bridge, which is an inversion. And an inversion is anytime the heart is above the head level or even lower parts of your body. So if your legs are elevated, your pelvis is elevated, whenever there's an elevation and a reverse gravitational direction of blood flow. And that's actually a great thing because we're always in this position where gravity is moving downwards. And so whether that's the walls of your veins in your legs that have to pump the blood up against gravity, or any of the aspects of moving blood flow back up to the body from the lower extremities. So what happens are studies done on inversions that when you do elevate your body against gravity, it increases the volume of blood flow in the upper chest area and throat, and there's receptors in the carotid arteries and in the aortic arch that actually notice that increased volume, and so it's a relief for the heart. The heart has to do less work to pump the blood through the system. So this is actually great for cardiovascular health, and there are counterindications for being in an inverted state. One of them is glaucoma. The other one is a headache, especially if you have a headache now. Not if you're prone to headaches, but if you have an active headache, that would be a counterindication. Glaucoma would be a counterindication, and unmanaged high blood pressure would be a counterindication. So even if you do have high blood pressure and you're on medications to manage it, that's actually considered to be safe to do inversions. So inversion, lifting the body a little higher than the head. I am going to do it today for myself with a bolster. It could be done with a block. And if that's too high of an elevation of your body, you can actually fold up a blanket or use a shorter pillow to have less of your body or to be not so far away from the floor. So choose what's good for you. It's a great way to stimulate parasympathetic nervous system or the relaxation zone, which is where we heal, we repair, we restore, and we build. So it's where we build bones. So let's set ourselves up in the beginning of today's practice in that way. And then we'll move throughout the practice with all that relaxation in your body, with the relaxation in your cardiovascular system, and with that hopefully raised awareness in your mind, meaning body awareness. So you can be safe when you do stronger postures. So having your strap handy, your block handy off to the side. And then the blanket will go up at the top. Now we are going to invert ourselves, lifting our pelvis higher. So I would recommend that you have a more narrow fold of your blanket or no blanket at all. So do what's appropriate for you, and then have your prop, whatever you're gonna put underneath your body, handy. It could be a block and it could be a bolster. I'll show you both. So either a block or a bolster. Bring yourself to the side and come all the way down. So to get either one of these underneath your body, you walk your feet closer and you take your prop and lift your body away from the ground and then place yourself onto the prop. So you either do this with a bolster or you do it with a block. You know, not quite as comfortable with a block, although really amazing to do this with a block because it also starts to stretch a lot of the muscles and ligaments and connective tissue of the pelvis. Yet it's not as enjoyable as a bolster is. So choose whatever's appropriate for you. Could be a pillow, could be a blanket, could be a rolled up towel, just something to elevate your pelvis. And then notice when you do that, where the pressure is in the upper body. And most of it should be in the upper back area, not in the head and the neck. So pay attention when you are in this position, what feels appropriate for your body. And then to protect the spine, press your arms into the ground, lift your rib cage away from the ground, slide the shoulder blades closer to the spine so that you protect your spine and do not cave in on your spine. Then your arms could be out to the side like a scarecrow, or wide, or lower if the shoulders need. Begin to close your mouth and connect to your breath, breathing in and out through your nose. Beginning to bring your awareness to this moment. Mouth is closed, breathing in and out through your nose. Then bring your awareness to your breath as it comes in your body. And start to breathe down to your belly. So the primary breathing muscle is the diaphragm. It surrounds the lower ribs. And you actually have the contents of your belly pressing up against diaphragm. So there's more pressure pushing into your diaphragm when you're elevated like this. So use your awareness to activate your diaphragm, pressing downward as you inhale, feeling your belly rise, going against gravity of the movement down of the digestive organs and your intestines and whatever else is in your abdominal area. Keep your mouth closed, breathing in and out through the nose. And see if you can get your belly to rise and fall with breath. And then notice, is the movement mostly in the front of the belly? And can you start to move to the sides, getting wider as you breathe in and out? And then begin to breathe down to the tailbone area. So in, back, and down, either to the bolster, the pillow, the block. Direct the breath down and back. And you bring your awareness to your entire diaphragm. And as you breathe in and out, feel the movement downward, feel the pressure created in the abdominal area as you breathe in. Begin to slow down your breath. And then add a pause at the top of your breath and a pause at the end of your breath. And stay with your breath. Bring your awareness back to your breath if you get distracted. And then finishing the breath that you're on, take 3 more breaths, long, deep, slow. Let your diaphragm press deeply down towards your belly. When you finish the last breath, let your breath go back to your body to breathe itself. If you'd like to move your arms in any direction or leave them where they are, so this is a perfect position to stretch hip flexors. One of them is actually attached to your lumbar spine, so pay attention when you do this, how it feels for your body. So taking one leg straight, that's going to stretch the front of that leg. This may be good enough for you, or you may be able to bring the opposite leg in and either hold on behind the hamstring or in front of the shin. So see which one feels better. Feel a pretty strong stretch on the opposite leg, especially because you're going beyond the 180 of the leg. So getting a little deep stretch in those hip flexors, making sure it feels appropriate, drawing the knee into the chest if that's appropriate for you. Sometimes holding on behind the hamstring area and pushing down on the femur bone. So you push the femur bone down towards your belly as opposed to drawing it towards the back wall can add extra stretch in the front of the hip flexor muscles. You may even feel that all the way up to the pelvic bone. Take one more breath. And then we're going to switch. So go slow to see how your hip flexors manage this. First thing you want to do is take the leg straight, noticing what you notice here. Do you feel that in the low back? Do you feel it in the front of the leg? Does it feel appropriate for you? Only doing what's appropriate. Next would be to add the opposite leg, if that's okay, either behind hamstring or on the shins, paying attention to the straight leg side. What's happening in the back of the body, what's happening in the front of that leg. And then doing whatever you need to do to the opposite leg if you're holding on to the opposite leg. Take some deep breaths, keep your mouth closed. Take one more breath. If you'd like to try both legs straight, arms straight, doing a back bend, but at the lower part of the spine here. So getting a back bend. You'll also bring that back bend into the top part of the spine. So it is a supported back bend. Often we put something behind our thoracic spine, in this case, behind the pelvis. So just exploring in your body, see if you could feel the belly stretch between the pelvic bones and the lower ribs. So this will be good for your spine, creating space in your body. Take one more breath. And then bend your knees. So when we do the inversion and when we bring our awareness to our diaphragm, the diaphragm is the top of the core. And because you've got this downward pressure and the contents of your belly pressing up against the diaphragm, when you breathe down and you get your belly to rise, you're actually strengthening the top of the core. So a lot of good aspects of doing this supported bridge posture. So let's do a little break for the veins of the legs. A little deeper inversion. Remember, not for glaucoma, current headache, or anyone with unmanaged blood pressure, high blood pressure. So take your legs up. You either could have your knees bent or you could unbend your knees. Press your heart up towards the sky so you're not caving in on your chest. Bringing the arms to the side can be supportive of that action. And then you could straighten your legs or keep them bent. Take your feet a little wider than your body. Inhale to point and exhale to flex. Inhale, point, exhale, flex. Inhale, point, exhale, flex. So I had read a little bit about this, that this can be really good for varicose veins because it gives a break to the veins and the apparatus that helps to move the blood back up against gravity to the heart. So giving your veins of your legs a break, letting all that blood and fluids flow to the pelvic area, and then from there to the heart and to the head. Inhale to point, exhale to flex. And then back to neutral. Circles. Go slow. Look at your feet, look at your ankles. One direction, and then the other. And then let's do bend and straightening of the legs. Go slow here. Activating quadriceps and hamstrings. Lengthening and contracting the upper leg muscles, warming them up. Try to reach through the heel. Try to go to straight leg if you can. Requires some flexibility of your hamstrings. And then both at the same time, probably feeling the heat now in the quads. I find this inversion movement healthy for knees, especially for people with knee issues, taking gravity away from it, letting that joint bend and contract, and then all the muscles and connective tissue that mobilize this joint. Reach through the heels. And bring your legs up. Let's take the legs out to the side and back. Also, when you're inverted, it gives you a little bit more freedom for the hamstrings. So those with tight hamstrings quite often have a little more access to their hamstrings when they have the elevation of their pelvis. Feeling the adductor muscles work to open and close your legs. We use these muscles a lot in yoga therapy for osteoporosis to pull on the pelvis. And then go ahead and bend your legs. Settle, let your body settle here. Then go ahead and take out your prop, whatever it was you used. And move that off to the side. So if you'd like to fold your blanket so you have it in a double fold, you could do that now. Or leave it in a single fold, whatever feels appropriate for you. And then take your body into a fully stretched position here. And then bend your knees. So let's go into forward folds that are acceptable for osteoporosis. Forward folding happens at the hip joint, and coming into a 90-degree is pretty much the maximum this joint will go. So we're going to do the leg stretching with a strap, and our intention is to use the muscles of the legs to pull on the pelvic bones. So trying to keep straight knees is important when we do this. We'll do the 3 leg stretches that are in yoga for osteoporosis. So let's do the first one first. It's called Supta Padangusthasana, or supine big toe pose. Traditionally, this was done by holding on to your toe, which is why it's called big toe pose, whether you did it out to the side or up on top. So it's called big toe pose, but we're actually going to do it with a strap. So draw the right knee in, put the strap on the right arch, take your hands down the strap, wrap your hands around. So hold on to the strap, one piece in one hand, one in the other, so you get a real firm fold. You could straighten the left leg if you'd like, or keep it bent. Pull down on the strap to get the leg to deeply root into the socket. And then preferably lower back is not pressing into the ground and you feel a very strong buttock connection with the ground. Let's enter this posture. Activate the leg, push the leg away, and now guide the leg towards the wall behind you. So come into the place where you feel a very deep pulling and stretch in the back of your leg. You're pushing away and pulling back, creating these opposing forces in your body and pulling down. So you feel the right buttock in the ground. You feel a strong sensation behind the right buttock as you push the leg away and pull it towards the wall behind you. Create as much tension in your body as you can while you're in the posture. Toes are pointing towards the wall behind you, pulling down, pushing away, pulling back. Take one more breath. And then go ahead and release the tension. Take the strap in your right hand. Slide your hand down the strap. Left leg is bent or straight, up to you. Keep the foot pretty high and do not let the foot move away from your body, away from your head. So if it starts to move away from your head, you're going to stop there. You're either going to use the block here to support the weight of your leg if you don't have a lot of flexibility in your body, or if you have a lot of flexibility, you might not need that. So let's inhale into the stretch. Keep your foot up by your head. Don't let it go away from your head. And when you come into the place that's the deepest stretch for you, stay there, hold. Pushing into the strap and drawing the leg up towards the wall behind you. Stabilize your pelvis here. Don't let your left buttock rock away from the ground. So activate your core, push your belly button towards your spine, push the left buttock towards the ground and left foot towards the ground. Feel that pull on the inner thigh muscles. Long right waist, so don't crunch up your right waist. Push your heart up towards the sky. Take one more breath. And then you release the tension out of your leg. Bring yourself back up. Bring the left foot into the strap, right foot on the floor. So you either have a bent knee with the right leg or you lengthen that leg and come into a straight leg. Wrap your hands around the strap. Create that real firm pulling down to the ground, firm left buttock into the ground. And then activating your leg, push it away and let's pull it towards the wall behind you. Low back away from the floor. You feel a lot of pressure in the left buttock and where the leg attaches to the body. Push away, pull back. Push your heart up towards the sky. Pull down, push away, pull back. Take one more breath. And then go ahead and release. To come into the side stretch, position yourself so you have the space you need. Lift your leg, and then as you enter this, keeping your leg high as you go to the side. When you get there, working to stabilize your pelvis, right buttock into the ground. Stabilize the pelvis, leg up towards the wall behind you, push into the strap, push your right foot or your right leg into the ground. Feel that inner thigh stretch. And long left waist. Take one more breath. Bring yourself back up to center. We're going to do the third big toe, supine big toe pose, which is both legs. So take both feet up. Bring your feet to be about hip distance, which is about 6 inches, really not that wide. And take your hands around your strap. So straight legs if you can. Try to keep the low back away from the ground. So pull down, feel the legs rooted towards the ground. Pushing into the sides of the strap, and then let's enter the posture. Draw the legs towards the wall behind you. Try not to tilt your pelvis backwards. So feel the pressure in the buttocks, in the sacrum, which is the center, the base of the spine, center of the pelvis. Feel that. Pull down, pull back, push away with the muscles of the legs. And feel that tension behind your legs. Pull back, push away. Take one more breath. And then go ahead and release, take the strap off. So those are the 3 leg stretches, the 3 forward fold positions in yoga versus osteoporosis, which is the work, the postures that Dr. Fishman has chosen to study. Put your feet on the floor. Let's warm up the hips, the pelvis a little more. Take your feet off your mat. Take your arms to the side in the scarecrow position and start to let your legs go side to side in a windshield wiper action. Feel that stretch in your body as you do this. And you'll even feel this in your legs. Hips, hip flexors, core, back muscles, leg muscles. Let your head go the opposite direction of your legs. Head and legs are opposite. Next time you come to the left, stay there. Let's stretch the right side. Flex the wrist, reach through the heel of the hand. Reach as long as you can on your right side. Try to push your right hip up towards the sky, stretching the right pelvic area. Reaching long with your arm, pointing the knee away from you. Take one more breath. And then you're going to bring yourself back to center, coming over to the other side. Let your knees go off to the right, head to the left, reach left arm off and stretch the left side of your body. So feel the stretch. You create that stretch. The posture brings the stretch in and then you accentuate that. Take one more breath. And then bring yourself back to center. Let's do the bridge posture. Trying to bend your spine as much as possible. We'll do it with a strap, bringing the feet through the strap, loop the strap or tie it. And then you need your blanket away from the back of your head. So your goal during this is to create as much tension in the muscles of the back of your body, pushing away from the ground, making sure you use your arms, whether you have them straight, clasped, or elbows are bent. Using your arms as much as you can, your feet, your legs, your buttocks, and then trying to stretch the front of your spine. So we're stretching the front and activating the back. Move the blanket away from the back of your head, walk your feet closer to your body, push out on your strap, tilt your pelvis backwards, let your low back touch the ground, lift your head up, lengthen your neck, put your arms in whatever position you're going to put them in, push your feet into the floor, exhale. Now as you inhale, squeeze your tushy, lift your pelvis away from the floor, push away from the floor with your arms and your legs, and lengthen the front of your spine. So open up the front of your spine, coming into where you're going to end up, using the hands in whatever position is best for you. Do not look side to side. Really push away from the ground with the hands and the feet, or the arms and the legs. Push away from the floor. Lengthen the front of your body. Open the front of your spine. Unbend your hip joint. Lift your pelvis. Push away from the floor strongly. Bend your spine and take 2 more breaths. Bringing yourself down 1 vertebra at a time. Lift your heels away from the ground. Lengthen your spine, tilt your pelvis backwards. Try to stretch the low back and the low back vertebra. And then when you come all the way down, bring the blanket back under your head. Take your strap off. Knees into the chest. Massage your low back. And then bring your feet onto the ground. And then bring yourself onto your side. Pushing yourself away, bring yourself up. So move yourself off to the side. Bring yourself on to your blanket. All fours, let your spine settle, especially after doing that bridge posture for quite a while. Start to move around in your joints, side to side. And then forward and backwards. And bring yourself up. So for wrist stretching, you could do it up here where you take your hand and you bend your hand one way and then the other. Make sure you're pushing on the back of the hand and the fingers, or you can come onto the ground and do this. More intense to stretch your hands this way. Backs of the hands are on the floor, palms are up, fingers are towards your knees. So getting that wrist flexion, arms are straight, body weight moves back. More intense this way. So if this is too much for you, come up and do it in a kneeling position. But do what's appropriate for you. And then come up, put your palms on the ground. Fingers are towards your knees. And moving your body weight back is going to accentuate that stretch. So make sure it feels appropriate in the forearms. Keep your arms straight when you do this. And do what's appropriate for you. So either up in the kneeling position or trying this. And then bring yourself all the way up. So either high kneel or sit down and stretch your fingers. Stretch all four on both hands. Feel how that goes all the way into the forearm when you do that. And then your thumbs. So fingers, thumbs, and then move your fingers. So we're going to come into plank. Your choice, you could do the straight arms or you can come onto the forearms if you need to do that. So front body will be here for at least a minute. You could add on more challenges if you'd like. Take your hands underneath your shoulders. Take your feet one at a time behind you, bringing yourself up into the plank. And then if you're in this plank, try it with a wider stance to begin with. So take your feet pretty wide and then really push back so you feel your calves stretching. Push your feet into the floor. Feel like you're drawing your feet up towards your chest. And see how that really turns things on. And then bring your feet back to a neutral. Pushing back through your feet. Push your hands into the ground. If you'd like, you could lift one leg up. And then switch. Really strengthening the hip joint of the leg that's on the ground. The front of that hip. Both feet down, push back. Take one more breath. And then bring yourself down, catching your breath in whatever position is your favorite to do that in. Closing your eyes. Mouth is closed, breathe down to your pelvis. Move your neck around if you have tension in your neck. Open your eyes for a second. Do lateral movement. The head goes side to side. This is not about getting your head to your ear. This is about lengthening the side. So think about your pushing your ear up towards the sky and you get a pretty nice stretch. Bring yourself back to neutral. Teeth are together. Inhale and exhale, chin to chest. And then chin up. Feel that stretch in the upper back and neck. Elbows are underneath your shoulders. Bring yourself back to neutral. Rotation, keep your torso stationary and move your head side to side. And then bring yourself back to center. So I'd like to stand up today through a down dog, which is bending the hips, using a lot of upper body strength. So I just want to show you what that looks like. You want to make sure that it's your hips that are bending when you do down dog. Your spine is straight. So we'll do this, but for those of you that this looks like not something you don't want to do, then you'll just come to standing from a kneeling position. So the bending is going to happen here. Let's come up here for a second. Push your tushy back and bend yourself down, keeping your spine neutral. So no rounding of the spine. All of this is hip. So this will strengthen the upper body. It'll also stretch the back of the body. It's really great for foot health, for balance, for fall prevention, to keep the plantar fascia, the Achilles tendon, the calf, hamstring, glute, and back nice and limber. So take your, it's another inversion as well. So counterindicated for high blood pressure, glaucoma, or current headache. Take your unmanaged high blood pressure. Take your hands wide, flip your toes under, push your body back so your low belly comes closer to your thighs, and from here, lift your tushy up. Keep your hips bent, keep your head forward, and start to push one heel at a time towards the ground. Feel that stretch in the calf area. No rounding of your spine. Bring your awareness to the front of your spine. Make sure the front of the spine is nice and long and open. And then push both feet towards the ground if you can. Bending your hips, so keep pushing low belly closer towards top thighs. Head is active. Take one more breath. And then bend your knees. Keep your head lifted. Walk your feet back. So this would be you coming into like a gardening position or reaching down to grab something from the floor. Let your feet touch the floor. Your head is lifted. Your spine is long. The front of your spine is long. All the flexion, or most of it, is in your hips, and then some in your knees. Feet, make sure that you have your weight in your feet. Bring one hand on top of one thigh, one on the other, and you're in this deep hip and knee flexion. Head is lifted. Take one hand forward, take the other hand forward. Spine in the front of your body is nice and long. Push your heels into the floor, push your tushy back. Reach long with your hands. Front of your spine is long. So you are bending forward here in the hip joint, which is where it should happen. Take one more breath. And then push yourself slowly up. Take your blanket off to the side. And let's catch our breath in mountain. Posture of alignment, Tadasana. Either toes touch or are hip distance. Hands are down alongside your body. Mouth is closed. Breathe in and out through your nose. Breathe down to your pelvis and then breathe down to your feet. Take one more breath. Making sure that your breath has relaxed or slowed down. Let's go into a balanced posture from here, tree. Take your body weight to one side, whichever side you'd like, and come into tree. Knee goes out to the side. Bring your foot up in between your ankle and your knee. Push your foot into the ground. Reach down with your hands, up with your spine. Find something to focus on, a point that doesn't move. Put your hands wherever you like. Take one more breath. And then slowly bring yourself out. Find your mountain again, find your alignment. Once you have your alignment, you come to the other side, into your tree. Bringing your hands wherever you'd like. And smile. Take one more breath. And then bring yourself back to mountain. Find alignment. Bring yourself out. Let's take the strap and the block. When you bend, make sure you bend at your hips to grab anything. You do not bend at your spine. So just being really aware of that you're bringing in that hip movement. We're going to do chair posture with these props to keep us in alignment, because this is a nice aligned position to bring in that proper forward folding, like in the joints in the right way. So if you put the block between your legs and you bring the strap in your hands, bring your arms back. Your arms could go forward, then go back. So really bring your shoulders up, back, and down in that joint. Squeeze the block. And then start to push the tushy back, come into hip flexion. From here, when you're down low, bring your arms up, push out on the strap with your hands, push back with your tushy. Go as deep as you can in your hips, pushing back. You can lift your toes off if you'd like, so you're really weighted in the back. And then arms are up, pushing out on that strap. Deep breaths. Spine in the front is long. Take one more breath. And then bring yourself up and out. Back into Tadasana, mountain alignment, to catch your breath. To find that balance in your respiratory system. And then shake yourself. So let's do some of the standing postures. If you have issues with balance, get a wall or get a chair. The first one we're gonna come into is triangle, keeping our legs straight, bending again at the hip area. So the triangular shape in nature is the strongest shape there is for stability. So let's create this really strong stability in our bodies. Wider you can go, the better. So use a chair or a wall if balance is an issue for you. Wide stance, take the toes away from you and the back heel away. Wider because this is not an angle we're normally in our hips. So giving more stimulation in more areas in the pelvic area and in the top of the femur and the neck of the femur. Shoulders are forward, up, back, and down. Exhale. As you inhale, push your pelvis away from you. Bend that front hip until you can't go any farther. And once you can't go any farther, put your hand on the back of the chair, the seat of the chair, on your leg or on a block. Block in front or block in back. You decide. Then bring your awareness to your feet. Rip the floor apart with your feet. Try to move the knees away from each other. Really stretching the pelvis, reaching your arms up, and then rotate your trunk forward. Pushing away from whatever your hand is on, the chair, the block, the leg. Long spine. Take one more breath. To come up, push your feet into the floor, activate your core. Go slow as you bring yourself long and all the way up. Switch your chair or your block to the other side. Let's prepare the feet. Toes are away, heel is away. Wide stance. And then from here, shoulders are forward, up, back, and they're down. Reach down long with your hands. Inhale. From here, reaching forward, pushing your pelvis away from you, bending at that front hip joint. Feel the stretch coming into leg muscles. When you can't go any farther, you bring yourself down onto the seat, the back of the chair, the block, the leg. And then right away, pushing into the floor, ripping the floor apart. You'll feel that activates your body so you can bring that length into your torso, bending at the hip, long torso, and then rotate your trunk forward. Deep breaths. Pushing away, lengthening your torso, rotating your torso, pushing your feet into the floor. Be long in your limbs. Take one more breath. And then take your hand off. Use your core to support you in this position. Long spine and bring yourself up. Bring yourself out, back to Tadasana to realign. And then shake. So I'd like to do twisted triangle. I'm going to do it without a chair, which I don't do very often. It's pretty challenging balance, posture, strength, and flexibility. But we've done a lot today to stretch our legs. So let's see how it goes. So you could be near a wall. You could have a chair. Let's all do the right leg forward first. So set yourself up so your right leg can come forward. You're either gonna have a chair there, the block there, or be near a wall. Bring your right foot forward, left foot back. Wider stance with your feet is gonna be a little bit more stabilizing than to have the feet closer together. Hands are on the waist, the bend comes at the hips. So pushing the tushy back, especially the right buttock, because the right leg is forward, really draw that right leg back. Coming forward, you're either gonna be in the back of the chair, the seat of the chair, or if you're using a block, you're gonna use the block. You push down in the floor with your feet, down into the block of the chair with your hands, and then you rotate your spine forward. So you're rotating over the right leg. This is twisted triangle. The hand can be on your waist, or the back of the hand could be on the sacrum, really opening up that right shoulder, right upper chest, adding that rotational force for your lumbar spine, and a lot of force on that posterior hip capsule of that right leg, the forward leg. Push both feet into the floor. Push away from the floor with the big toe mound of the back foot. Long spine. Take one more breath. To come out, you bend the front leg to take the tension out. Keep the front spine long. Bring yourself up slowly and out. We'll go to the other side. Taking your chair or your block to the other side. Or staying where you are and just turning in the other direction. So bringing the left foot forward. Choose which stance distance you need, wide or more narrow. Toes are pointing forward. Push your feet into the floor, hands are on the waist. Then begin to lengthen your spine, bending forward, drawing that left buttock back. Deeply root that left leg in the socket. From here, hand is on the back of the chair, seat of the chair, or the block. When you have that connection, you push your feet into the floor, your hand onto the chair or the block, and you rotate your trunk forward. Hand is on the waist or on the sacrum. Deep breaths. Legs are straight. Both knees are straight. Add as much rotational force as you feel is appropriate for your body. Take one more breath. To come out, you take the tension out by bending the front leg. Keep your spine long. Slowly bring yourself up and out, back to mountain. Catch your breath. Mouth is closed. And then shake your limbs. So I'd like to do a posture called Warrior One, or you could do what's called Crescent. So the thing about the Warrior One is this. One foot is back. You either have the back foot on the floor, which is a little bit more stabilizing for balance. So for some, that may feel better to come into the Warrior One like that. The other option is to do Crescent, where the back heel is off and you're in a lunge. This is a little bit more tricky for balance. So you're going to decide which one you'd rather do, the Crescent or the Warrior One. If you want to have a chair, you could have a chair beside you so you could hold one hand onto the chair, choosing what's best for you, always doing what is the safest for you. So coming from a mountain posture into a wide stance, You take one foot forward, and then the back foot, you're either gonna turn your foot at an angle in, or you're gonna come all the way off into the crescent posture. You bend the front leg, so your hips are trying to point forward. And then you bend the front leg to load into this. So load into this from the lower body. So you're either leg is straight loading in, or the heel is off. Coming down into the warrior, exhale, and then inhale, bring your arms up. So if you needed a chair, you could have a chair on this side here of that front leg. So you could really get that lengthening on this side. Try to add a back bend, lift your heart forward, back heel off or heel down, you decide. Bend that front knee and push that front heel into the floor, draw that front leg deep into the socket. Breathe down to your belly. Take one more breath. Bring your hands together at your chest, and then bring yourself up and out of the warrior one. Let's go to the other side. Wide stance, toes are forward. Back heel is either at an angle inward. Bring your awareness to the front leg. When you bend the front leg and your torso goes down. You don't go forward when you come into this. So bending the front leg, let your torso go down. That'll add that deep work in the hips. In the warrior one foot position or crescent, bring your hands up. Draw that right leg or the front leg into the hip joint, whatever leg is front for you. You can bring the heel off if you'd like. In crescent, you decide. Add a back bend, lift your heart. Be as deep as you can in this posture to feel as much stretch in your body. A lot of pelvic and spinal and leg bone and leg muscle stimulation. Take one more breath. And then bring yourself out to mountain to recalibrate. Then shake your body, shake your legs, shake your body, shake everything. So we're going to come down, let this all integrate with the Shavasana. You could do another inversion with Shavasana at the end, or a regular Shavasana, you choose. So bringing yourself down onto the ground, anything you need to do at the end of the practice for your body, you can bring your knees into your chest or come straight into a regular Shavasana or even an inversion. If you do an inversion, don't have very much support behind your head, so either a very little or nothing at all. And then bring yourself into a relaxed position, closing your eyes, closing your mouth, focusing on your breath. Udare apare, Hariyam Kariyam, Diname Akame, Govinde, Mukande, Udare apare, Hariyam Kariyam, Diname Akame, Govinde, Mukande, Udare apare, Hariyam Kariyam, Diname Akame, Govinde, Udare apare, Hariyam Kariyam, Diname Akame, Govinde Mukande, Udare apare, Hariyam Kariyam, Diname Akame, Govinde Mukande, Udare apare, Hariyam Kariyam, Diname Akame, Govinde Mukande, Udare apare, Hariyam Kariyam, Diname Akame. Gently begin to deepen your breath. Let your awareness go throughout your body to notice what you notice about the practice you did today. Is it appropriate? Longer holds, stronger work. The more you bend, the more you pull, the more you push, the more bone building stimulation, muscle building stimulation you create. Was it appropriate? If you have something underneath your pelvis, remove that to the side. Draw your knees into your chest. Rock side to side. And come all the way onto your side. From here, using your hand to push yourself up to a seated position. Keep your eyes closed. We're going to close the practice with sound, a humming sound. Bring a vibration, a calming vibration into your body, to your mind. Hands are together at your heart. Push your hands together. Push them towards the heart to the hands. Mouth is closed. Take a big exhale. Inhale all the way down to the base of your spine. We bow to each other. We bow in gratitude, in mutual respect and recognition. We honor each other in the practice. So we did 12 postures today, held almost every one of them for at least a minute. Longer holds, more stimulation, deeper bends, more stimulation, weight bearing, the safest and best way to create that appropriate stimulation. So choose what's appropriate for you. The props you use, the wall you may need for support, each day is different. Choose what is the best for yourself. All right, so I would consider that a stronger practice today. A couple of, I brought Warrior One in, which I don't do very often. So, Kathy. Oh, Cindy. Hi, Cindy. Great. Well, okay, so Penny, here's what I'm going to say about going up and down the stairs every day. The whole thing about weighted vests and adding weight to your body for weight bearing, you have to have an aligned spine. So to me, it's not about adding more weight with things. It's about being properly aligned in your joints and creating the best forces possible. So if you have weights in your hands and you're doing that, as long as you're completely aligned in your spine, you're bending your hip the most, you're posterior in your weight, not forward in your toe pads, then I would say that's great. But honestly, your own body weight is good enough. Bend deeper. That's going to create more stimulation than it will if we add more weight to what we're doing. So that's my opinion on weighted vests and on adding weight. I know that a lot of classes bring weights in. We don't need more weight. Bend deeper. That's going to add more weight or more pressure or more stimulation to your joints. Because you have to be sure that you're posturally aligned. And I'll say most people do not perfect their posture when they're doing things like that. So if you do, then great. But that's my thing. Oh, yeah. Cindy, so for that twisted triangle, I think I definitely did the wider stance than I usually do because I was in the middle of the room and I don't want to risk falling. That's probably one of the postures I've seen people fall out of the most when I've done, group classes, not necessarily that I've taught, but just in all the yoga I've practiced over the years. You're welcome, Stevie. Good, Jean. Strong, challenging, but good, right? You could handle that. I mean, that's what we're here for, is to get stronger. So why not give it our all every time we show up? What was I going to say? 3 more weeks of, this YouTube channel I'm going to keep. I'm going to do this Thursday class always on YouTube, but I am going to go back to live teaching in my other classes, even Saturday. I just added Saturday yesterday. So I'm going to do 4 live classes a week starting in July, and we'll see how it goes. So for those of you who live in Southern California, you can join me live, and those who do not, I'll still be recording. We'll be on video. All right. Have a wonderful day, ladies. If you're going to eat protein, especially my favorite, perfect aminos, do it after you work out. And have a great day. All right. Bye. Thanks, Penny. I'm glad. Oh, Sharon. Good. Off for a walk. I've already done 8,000 steps today, so I'm getting my walks in early. All right. Bye, everyone.